My name is David Akuh. I'm a third-year nursing student at Brown University. My project's about concussion in sports. So many people experience concussion without knowing what actually is, right? So then it's just like an avenue to explain what truly concussion means. And concussion is all about that brain injury that occurs. Sometimes it might not even be an injury, but it's like a shift to the brain that causes so many symptoms, like headache, dizziness, nausea, balance problems, fatigue, and all of that. And when that happens, it could be caused by a hit to the head or probably a hit to any part of the body. But what has to happen is the brain has to be affected. The brain has to like probably move or maybe irritated some kind of way, which causes the concussion, right? So necessarily, you don't have to like, I don't have to like fall down. I don't have to like be weak. I don't have to like experience so many symptoms without, having concussion. So most importantly, focus more on we try to focus more on the, not just the physical symptoms, but more of like subjective questions. Like I could ask you, let's say you got hit in the head. You could tell me I'm fine, I'm okay, everything is fine. But you might not even know you're going through concussion. I could ask you, what's your name? Where are you? And you don't know where you are. So like that is like something is off somewhere, right? It's going to show me like, okay, the brain is not in the right state right now. So but most people believe, oh, maybe if you have concussion, you're like weak or you're throwing off or maybe you're even unconscious. So it's more about like letting them know that there are more symptoms to it. You can be confused, you can not be alert, you can also be alert and saying what is not right. So that's also based on the project. And also talking about the signs, talking about the risk factors as well. Um, Previous concussions could worsen, more problems for you because if you've had a concussion before, you had more risk to have, another one. And it's like parents and coaches have to realize that, when something is wrong, because I'm used to, let's say I'm a parent, for instance. I know how my child talks to me. I know the activities my child does. So then I come to my child, I'm asking, are you okay? Are you fine? And I notice something is off. So the first thing to do is, because your child is in a sport, you know, as there be any hit to the head, as there be any like problem that occur to the brain. So that is something to also take note of. Because some parents could notice something might be off with their kids, but they might not think, concussion. They might think concussion, you should be lifeless, you should be unconscious, you should probably even die at that point in time, right? But it's not that deep. It's something that like it happens gradually, and without it being noticed at that point, it could get worse. So early recognition is very good. And for treatment, actually, when you get to the hospital, there is this acute concussion evaluation. This is what we use in the hospital in emergency. You could like, if you have a concussion, this is what you use to treat them. You're going to be asked questions. You're going to be provided, some kind of medications as well that could help you with that. And when you're leaving the hospital, you're going to be provided some discharge packages, just like this, like how to recover fully, and how to care for your child as well. And other treatment as well, the best mode of treatment for these people is take some time to rest. You know, for example, in rural areas, there are no many sports um, participants around, right? So I can say I had a concussion today. I'm okay. I want to go back tomorrow. So you have to take a while to rest and recover till you're sure you're good. Then you can go back to practice. I want it to like spread across as far as it could, spread. Anyone who sees this should be able to learn from it, whether here in Canada or anywhere else around the world. The major thing is sports happen everywhere. So anywhere sport happens, I should learn about it. That's it for me. I'm currently in my third year. Very soon to my final year. That's like still this year actually. So my goal is to complete nursing, pass my NCLEX, and I'm actually want to focus more on ICU. Like, I'm still gonna take a further course to like go to the ICU, try to focus on more um, sick patients in quote, or more challenged patients, and help them out with whatever that's going on.